It is my pleasure to deliver the presidential address. Your Excellency, President Dr. Bon Kong Siatavang, Director General, Dr. Tedros Adhanom Ghebreyesus, Honorable Ministers and Heads of Delegation, ladies and gentlemen. I join the Assembly in congratulating Dr. Sihathavong, Minister of Health of the Laos People's Democratic Republic, for the poise, eloquence, and order he brought to the chair of the President during the 72nd World Health Assembly. In these uncertain and challenging times facing the global community, the resolute and inspiring leadership of the Director General remains certain, and we commend you and this organization, Dr. Tedros, which requires the global mantle for a healthier, safe, and fairer world. This presidency has great meaning for the people of the Commonwealth of the Bahamas, and indeed the Caribbean community and diaspora. I would like to take this opportunity to personally thank the government and people of the Commonwealth of the Bahamas for the confidence they have shown in selecting me to serve in this post at such an historic time. It is indeed an honor and privilege. We convene the 73rd Assembly during an unprecedented time in history when the global community is faced with negative health, social, and economic effects of the spread of the coronavirus. And the Assembly convened virtually, bringing together participants from across the globe. The public health community has faced challenges in the past. Global health issues transcend national boundaries and governments and call for action on the part of the global forces that determine the health of people. However, at no time in our recent memories has there been such a global impact of a disease, placing the lives, livelihood, and learning of so many in peril, disrupting supply chains, and bringing economies to a grinding halt. Statistically, in terms of numbers, the burden of COVID-19 has risen to over 4 million confirmed cases and close to 300,000 deaths in all 6 regions of the World Health Organization. In the wake of COVID-19, we have witnessed stock markets tumbling, unemployment rising in historic highs, conditions in fragile settings exacerbated, and peace and social cohesion threatened. Over the centuries, global action has yielded countless successes for global health, improving not only longevity, but also the quality of life. Ancient Babylonian civilization heralded the sewage systems designed to protect water supply from contamination and disease. The discovery of pasteurization in the 1860s was a turning point in securing the safety of food supplies. The post-World War II era gave the global health community the tuberculosis vaccine. The past 25 years have witnessed a particularly golden era of unprecedented health achievements. child mortality cut by 47%, maternal mortality reduced by 45%, and reversals in the spread of HIV and AIDS, malaria, and other diseases. This era of COVID-19 ushers in new technology. It requires new knowledge, new innovations, flexibility, meaningful, respectful country interactions, as well as new and greater global partnerships. The role of the World Health Organization in this time of crisis reminds us that we live in an interdependent and interconnected world, where health and well-being are shaped by circumstances, decisions, and events occurring in distant places. Bacterial and viral threats travel almost as quickly and unencumbered as email messages, Twitter, and money flows. The World Health Organization must be steadfast in guiding the response to COVID-19, and at the same time, exact a balance with its mandate to meet the challenges that threaten the survival of many people, including those with chronic non-communicable diseases. The mere nature of our explorative spirit and our humanity suggests we will overcome these challenges. We will find solutions to these current realities that confront us now and in the aftermath of COVID-19. We will embrace new lifestyles that promote good health. We will repurpose and maximize our resources. We will establish a new balance between the economic, the physical, and the psychological welfare of our citizens. While we have lost a generation of elder citizens and those with comorbidities due to COVID-19, we must be resolute to preserve those who are with us. Juggling the health welfare with the social and economic pressures confronting us signals the complexity of the moment. But we are up to the task. Successfully negotiating COVID-19 and the post-COVID era requires that we shift, we recalibrate, and make key investments. It requires that we invest more in new technologies which are accessible to the majority of the people, that we take measures to protect the most vulnerable during the epidemic, and that we address the economic aftermath of worsening inequities. The Assembly would recall that in September 2020, Hurricane Dorian, a Category 5 climatic event, mercilessly brought mass devastation on the islands of Abaco and Grand Bahama, two of the more northern islands in our archipelagic chain. For us, Dorian amassed 74 official deaths, but it displaced thousands and exacted an economic toll of $3.4 billion in damages and losses. The Bahamas has yet to recover from Dorian and does not have the luxury of dismissing COVID-19. The Bahamas must delicately strategize to mitigate the human, social, environmental, and financial fallout of Dorian and COVID-19. This is no small task, but we will not be daunted. We will rebuild strong. Our resilience continues to propel us to new strengths. Despite the financial challenges, the Bahamas, as evidenced by its modeling approaches, has demonstrated the positive impact of public health measures for COVID-19. To date, the Bahamas has confirmed 96 cases of COVID-19 and 11 deaths. The number of recovered cases are at 43. There are 7 hospitalized cases. 1,814 tests have been completed. I salute the millions of healthcare workers who valiantly stood in the gap as we fought the spread of the virus and its impact on the global community. Some lost their lives. Others endured substantial emotional and mental strains, but all continue to give their best for mankind. In conclusion, the bedrock of public health remains constant. Equity, quality, whole of society approach, collaboration, and solidarity across boundaries and borders. As we deliberate over the next 2 days, I trust we will manage our time effectively and efficiently and remain resolute in our determination to aim for the greater good, the common good, the public good. Thank you.